I see you on the Instagram and I see you on the Zoom.
All right, let's do that.
Okay. Awesome. So for those of y'all who are joining in on the Instagram live, my name is Dr. Anousha Usman, and this is Dr. Ami Patel, and we are doing an Instagram. We are doing a progesterone masterclass. So if you're tuning in here on the Instagram space, you'll just be hearing our faces talk, and we're going to do our very best to explain everything. If you haven't already, you can message. Actually, maybe it's a little bit late now, but our webinar, our masterclass will be posted online. It'll be free and available, so you can check out our slides and pictures, and it'll be great. Awesome. Are we ready, Dr. Ami?
Yes, we are, and you guys can drop questions on the Instagram here or in the Zoom, and then we'll get to them at the end.
Great. Okay, so let's take it away.
All right, well, thank you everyone for joining this master class on progesterone, and we will just dive into the topic, but we'll start with a little bit of an introduction of ourselves. So my name is Ami Patel. I'm a pharmacist by profession, and I'm really passionate about this subject because I was diagnosed with PCOS about 7 years ago, and from that time, I was just put on birth control, and I didn't really understand PCOS or ways to kind of approach managing my symptoms. So I took it upon myself to learn like more holistic and natural approaches to managing my PCOS. And I started sharing my journey, my PCOS journey through Instagram and YouTube since January of this year. And this is why I was able to connect with Dr. Anousha Usman. And now she can introduce herself.
Okay, great. I was just making sure there was no feedback. So hello, welcome. My name is Dr. Anousha Usman. I'm a naturopathic doctor here in Toronto, Ontario, Canada. I guess if you aren't familiar with naturopathic medicine, what I like to share is that naturopathic medicine is very similar to Western medicine or allopathic medicine in that the body's the same, diseases are the same. What's different is the treatment approach. So your family doctor might prescribe you various medications to treat your symptoms. Naturopathic medicine aims to treat the root cause of disease. So why are you experiencing what you're experiencing, and how can we help to not only reduce your symptoms, but prevent it from becoming anything more serious in the future? So some of the different modalities in naturopathic medicine are, oh, I think I can hear me on your side. We're good at the science, but we haven't quite figured out the tech yet, but I think we're good now. So there's different modalities in naturopathic medicine, and those are nutritional lifestyle, dietary counseling, as well as more hands-on therapy like acupuncture, acupuncture and cupping and gua sha, which all fall under the traditional Chinese medicine category, and botanical medicine. So a lot of different herbs, while they are gentle, they do also help to support the body in reducing symptoms and preventing the symptoms from getting worse. So some of my clinical interests are women's health, hence the progesterone talk, and women's physical and mental wellness. So menstrual and mental wellness. And I think that those go hand in hand together, because our moods, how we feel, our energy levels are also tightly wound and influenced by our menstrual cycles and vice versa. So that is a little bit about me. I think I just shared so much information about naturopathic medicine. But yeah, why don't we jump into how periods work? So essentially there's two cycles in a period, two phases in a cycle, and that those are the follicular and the luteal phases. The way that you would know where you are in your cycle is the first day of your period. That's when you start a new follicular cycle. So we have half the month is you're in a follicular phase when your body is preparing for ovulation, and then you ovulate, and then you are in the luteal phase, and that's when the body is preparing the uterus. And then if there's no baby, then you bleed. So a full cycle is anywhere from 26 to 35 days, and most women fall somewhere in that normal. So if you're tuning in to perfect, if you're here on the masterclass, you get to see the awesome graphic courtesy of Wikipedia. There's some great stuff on there. But anyways, essentially here we can see that this is a very textbook example of 28 days. So the first 14 days are your follicular phase. That's when the body is supporting the ovaries and helping the ovaries to release this egg. And so your egg is getting ready. And this egg actually wears a coat. And so around ovulation, the egg is released, it sheds this coat, and then it goes off towards the fallopian tubes, and then eventually waits for to be fertilized by a sperm. And then once that happens, we're now in the luteal phase. So the luteal phase is when the uterus is starting to prepare for baby. So now I did mention that there was a coat. So that coat releases a hormone that helps to support the development and thicken the lining of the uterus. And so that thickening helps to prepare the uterus for baby. If there's no baby, that lining will shed at the end of the month. And as soon as it starts shedding, we've now switched back into the follicular phase and we start our period and the whole cycle starts again. All right. Okay. Wow, so many screens. There we go.
Okay, so there's, like we were just talking about, progesterone, which is the hormone that's naturally produced in the human body, but we're also going to be touching on bioidentical progesterone and progestins. So these are really important because it's important to know these differences because progestin is found in birth control, and that's something that's synthesized in the lab, and it's chemically different structure-wise than progesterone. But bioidentical progesterone is kind of like in the middle of both of them. It's similar to human progesterone. It's from a plant source, and it's modified a little bit, but structurally it's the same as progesterone. And we'll talk more about these in the next slides. So progesterone is, there's lots of benefits to progesterone. We may think that we may not need like our different hormones if we're not worried about having a baby right now. We might think like, oh, it's fine. Let me just, take the synthetic progestins like birth control and worry about progesterone when I want to have a baby. But there's actually a lot of benefits to progesterone that you need, regardless of whether you want to have a baby right now or not. So some of these things that progesterone is known to do is decrease inflammation, it calms your nerves and reduces anxiety and stress, promotes healthy sleep, builds and maintains your bones, it protects you against breast cancer and uterine cancer. It promotes fat storage, it helps your cells use the thyroid hormone, and also it helps maintain a healthy pregnancy, which we'll touch a little bit on later as well.
All right. So how progesterone affects PCOS. And so this is something that both Dr. Emmy and I have an interest in. And so with PCOS, one of the symptoms of PCOS are not ovulating or having anovulatory cycles, which basically means it's a fancy way of saying you're not ovulating or you have irregular cycles, among other common PCOS symptoms. And so when you're not ovulating, you're not producing your own progesterone. And so that occurs because that coat that we mentioned earlier, that hormone that's being produced is the progesterone. So if you're not ovulating, you're not producing your own progesterone. And you have this relative estrogen dominance. So one thing that we didn't jump into is in our cycle, we have a cyclical nature of our hormones. So as progesterone goes up and down in our cycle, as does estrogen. And if progesterone's a little bit lower while estrogen is also increasing, we have that relative that relative dominance. Progesterone also affects fibroids and endometriosis. And so with regards to fibroids, that's women who experience fibroids can have very heavy, painful periods. And that's when we have like a thickening, quite a thickening of the endometrial lining. And so progesterone is thought to contribute to the development of fibroids. So more progesterone means more chances of developing these fibroids in some women. The way that progesterone also influences endometriosis is so endometriosis is an autoimmune pathology, and that occurs when uterine tissue grows outside of the uterus. So we talked about in the latter half of the cycle, when your uterus is preparing for baby, it's getting nice and thick and ready. And in endometriosis, those same tissues are getting ready for baby, but it's happening outside of the uterus. So somewhere where baby's not going to end up anyways. And this can lead to heavy cramping, lots of pain, and heavy periods as well. So with endometriosis, the hormone signaling gets affected. And so it's something that is akin to progesterone resistance, or again, a relative estrogen dominance. So while the mechanism of action for endometriosis isn't totally understood, but in one study, actually, they had given rats, they'd given some rats progesterone prior to giving them endometriosis lesions. And they found in the rats that were given the progesterone versus not given the progesterone, they had less inflammation and less progression of the disease itself. All right. Oops. Okay, and so some signs and symptoms of low progesterone are irregular periods because you're not ovulating, then your body's not preparing the uterus for a pregnancy anyways. Some women might also experience difficulty conceiving. Women with lower progesterone may also experience frequent miscarriages. So they do get pregnant, but then they lose the baby soon after. Or they might have preterm birth. Likewise, they might experience spotting during their pregnancy or just spotting in their regular cycle.
Okay, so now we'll move into talking a little bit about the bioidentical progesterone. So like I mentioned, this comes from a plant or wild yam. Dioscorea is the species name. So this is derived from a plant and it's modified to mimic the natural progesterone. And it's different than birth control, like I mentioned, because its chemical structure is completely different. And bioidentical progesterone comes in many formulations. It could be a topical substance like a cream or a serum, or it can be oral or injectable. And this can be used like 1 to 2 weeks before your period to help with the PMS symptoms like we talked about, like anxiety, irritability. You know, it can help like calm your anxiety and nerves down, promote sleep during that time as well. And like we were talking about, it can help increase your progesterone level to aid in starting your cycle. So progestin is not the same as progesterone, like I mentioned. And, you know, since we were just talking about how progesterone is really important in maintaining a pregnancy and improving fertility, progestin is the opposite, birth control, which is, you know, basically preventing pregnancy. And the way it works is that it prevents ovulation and it decreases the cervical mucus, which makes it harder for sperm to get inside the body. And so since with birth control, you're not ovulating, you don't produce that natural progesterone and you don't get all the benefits that progesterone has to offer that we talked about earlier. And so here we can see that there's actually like 3 different categories of different types of progesterone. that are in the birth control medication. So if you're on birth control, you can see like, what the name of the medication is or the type of progestin that's in the medication. And you can see what kind of class it's derived from, whether it's from testosterone, progesterone, or spironolactone. And this is important because certain medications can cause different side effects. So the one that like we're really concerned with, for example, with PCOS is androgen related effects. And, that's if it's derived from testosterone and you have more testosterone in the body, then you have unwanted side effects like acne, unwanted hair growth, or hair loss from the head. And birth control is prescribed for PCOS often because in combination with the progestin and estrogen, it can um, kind of mask these symptoms, or it can decrease the testosterone level or prevent the testosterone from binding to your cells that cause things like acne and unwanted hair growth and hair loss. So that's commonly why birth control is given for symptoms of PCOS. But if you are taking a progestin only pill, something that's in like IUDs, mini pills, implants, or injections, then it can actually make these symptoms worse, like acne, unwanted hair growth, and hair loss, things like that. So, if we just go back to the charts, if you know what medication you're on, kind of make note of the generic name that's in the medication, and you can consider talking to your doctor if you feel like your birth control may be, worsening some of your side effects.
Definitely. And that's something that's prescribed a lot. Birth control is something that's often prescribed in women who have any sort of menstrual related um, symptoms. All right. So I can hear my feedback. Okay, so when to speak to your healthcare provider. So Dr. Amni did mention that if your birth control is potentially worsening your symptoms, or you're experiencing acne, hair growth on the face, or hair loss on the head, those are symptoms of more male type hormones. That is common in PCOS, but can be even exacerbated depending on the type of progestin that's in your birth control. So if that's something that you're experiencing, worth mentioning to your healthcare provider. But what are other times that you can reach out to your doctor? So we have a couple listed here that I'm going to share with you. And that is when you start to notice consistent changes in your cycle that are not linked to stress, birth control, or pregnancy. So if you chart your cycles, and you're noticing like, hey, in the last 3 to 6 months, your periods have just been off and there haven't been any changes. The pandemic is not affecting your period, or hadn't been affecting your period before, or now it's affecting your period, or in a world where there was no pandemic. If you're noticing changes in your cycles, that's a good time to speak to your healthcare provider. If you note consistent spotting mid-cycle, so we talked about that transition from follicular to luteal phase. So as progesterone starts to increase, it prepares the uterus for a baby. But if the progesterone is kind of like lagging behind, or it's not enough, some women tend to notice mid-cycle spotting. So that's spotting in the middle of your month when you don't have your period. If you're experiencing difficulty conceiving or frequent miscarriages, if you have spotting during your pregnancy, and finally, here's our buddy, he's just here. Finally, if you have irregular cycles, again, if you experience PCOS, and that is a good time to reach out to your healthcare provider and talk about having your hormones assessed, and that includes progesterone. One thing that is worth noting is progesterone is actually tested at a different time during your cycle. So most of your hormones are tested around like day 3. Progesterone is tested at day 21 in your cycle, or about a week before you start bleeding. So if you are going to have your hormone levels tested, make sure you do talk to your doctor about where you are in your cycle to best test for your hormones and for your progesterone. All right, so that was packed. That was a lot of lots of information about progesterone, progestin, and birth control. So why don't we open it up to some questions from our audience?
I think we had one earlier. Someone
Yes.
asked, is it considered regular 26 to 35 days if it's any number in this range? Okay.
Yeah. So the 26 to 35 days, that's a normal range. So whatever your normal is, as long as it's relatively consistent, yeah, it is normal. So some women have like 26-day cycles and that's fine, and other women have regular 35-day cycles.
Is there like any apps you recommend for tracking cycles?
Yes. There's a few. There's one called there's Flow. Any period tracking app that you're consistent with, I recommend. And when you're charting your cycles, chart when your period starts. So again, the first day that you have a full bleed, that's day one of your cycle. So let's say you have lower progesterone and you started spotting prior to a full bleed. That spotting is not the first day of your cycle. That first full day, full bleed, that's your full day of a cycle. And I recommend also making any notes when you experience the spotting. And that'll just help give you the information that will help equip you when you go speak to your healthcare provider about your cycles.
Another question that I was thinking about. So when is it appropriate, like when you come off of birth control and you haven't been making your own progesterone for many years or however long you were on it, is it normal to kind of take like the bioidentical progesterone for a short period of time until you start producing your own progesterone?
Some women can do that. It is normal to have pretty wonky periods after you come off birth control. So, like speaking from clinical experience, some of my patients have had their period return back to normal just in the next cycle. Some have taken upwards to a year to start to have a regular cycle again, and that all boils down to what were your cycles like before birth control. So if you had regular cycles before and you took birth control for birth control reasons, chances are your period will probably come back sooner and more regular than normal, regular. But if you had PCOS or irregular cycles before, it might still continue even after you've stopped birth control.
Okay, that makes sense. And that's probably when, we should speak out and kind of like approach a doctor and be like, my cycles are not regular anymore.
Definitely. And so if you haven't started charting your cycles, please start charting them.
Yeah, some of the apps I like are Clue. Clue is like really basic, just kind of get into it a little bit. I also really like Ovia. That's a good app if you want to start charting more than just your cycle, like signs of ovulation, other things that could affect you and your cycle, like, what you eat or stress, sleep, things like that. So those are some really good apps that are free as well.
Mm-hmm. Anything that helps keep you consistent.
Exactly.
Awesome. So I think that is it for questions. I don't know if we had any questions in our group, in our masterclass. I don't see any. All right. So Dr. Emmy, if someone was going to get in touch with you, where can they find you?
I'm on Instagram and TikTok at PCOS Healing Adventure, and I'm also on YouTube. I have a YouTube channel, PCOS Healing Adventure with Dr. Ami Patel. This masterclass video, we will also post it on YouTube afterwards if anybody wants to check it out for the full information, or if you want to share it with somebody that you think would benefit from the information, you can find it there.
Great. And if we haven't met yet, again, I'm Dr. Anousha Usman. I'm a naturopathic doctor. And you can find me at dr.anousha Usman on Instagram. And my website is thewellnesssweetto.com.
And are you seeing patients if somebody wants to be one of your patients?
Yes. yes, I am seeing patients within Ontario. And so I'm seeing both virtual and in person.
All right.
Virtual for anybody in Ontario, and in person. I mean, if you're willing to drive to come see me, you are more than welcome.
Awesome. Well, if you guys have any questions, you can always reach out to either of us. You know, we would be happy to answer any questions you have. If you look at your birth control and you have questions about the progestin that's in there, definitely let us know as well. If you have questions about, when you can utilize birth control or bioidentical progesterone, let us know, right? Does that sound good?
Yes.
All right.
Awesome.
Well, this was great. I'm so glad we got a chance to talk about this topic that isn't talked about often. So definitely, was happy to do this.
Yes. All right. Great. So can't wait till our next one.
All right. Well,
All right.
everyone has a good night.
Bye.